Today, we are very honored to be joined by three distinguished guests, Mr. Antony Leung, Professor Winnie Yip, and Ms. Jing Wan. Mr. Antony Leung is the co-founder and chairman of New Frontier Group. He's also the chairman of Nanfeng Group and had many senior roles in the financial sector. Outside of the private sector, he also served as the financial secretary of Hong Kong SAR. Dr. Winnie Yip is a professor of the practice of global health policy and economics at the Harvard Chan School of Public Health. She's the director of the school-wide initiative Harvard-China Healthcare Partnership, and she's also the director at the Harvard Fairbanks Center for the Chinese Studies. And we also have Ms. Jing Wan. She's a partner at McKinsey and now leads McKinsey Greater China's healthcare practices. Thank you all for joining us. We'd also like to welcome our audience in front of the screen, no matter where you sit. Thanks for making the time. Before we start the discussion, I wanted to remind you that if you have any question to the panelists during the talk, please feel free to submit them via the Q&A button on Zoom. Okay, let's now jump onto the topic. I'd like to open our discussion with a reflection on China's healthcare reform. Professor Yip has been very much involved in studying and advising the healthcare reform in China and many other Asian countries. The Healthy China study you advised at the World Bank and WHO has been accepted and integrated in the making of the latest 5-year healthcare plan in China. Professor Yip, can you just quickly go through some of the highlights you find in China's healthcare reform and how it pertains to the growth of the private sector in the market? Thank you.
Well, thank you very much. Thank you for the forum to invite me to speak at this forum. China's healthcare reform, first of all, is an ongoing process. And I would say that it actually started as early as 2003 and is continuing. Let me try to focus on a few main points. One main point about China's healthcare reform is that the government has made it very clear that the government has a strong role in healthcare for equity reasons. But there's also room for the private sector. But China is also very clear that the government's role for healthcare is for basic healthcare. And whereas the rest, there is plenty of room for the market, but China never defined what is basic though. So that's something for us to ponder and discuss. And so I would also define then thinking about China's healthcare reform into financing versus delivery. And I'm sure many of you know that since 2006, China has rolled out a universal public health insurance scheme that now covers 96% of its population. Except for the urban employee scheme, the rest of them is actually highly subsidized by the government. And so people who are not working in the big big firms actually would still belong to a health insurance program, which in China is called Yibao, and but they only pay about 15% of their premium. Now, this is gradually changing. And in fact, if I would jump to the 14th Five-Year Plan, there is actually clear direction that China wants to define what is basic for its social health insurance much more explicitly, and meaning that beyond basic, there will be a role for private insurance. But exactly what role would that private insurance be and who would they be sold to? What is the regulation? I think that this is still in the experimental stages. In terms of delivery, there's no question that China's healthcare system is dominated by the public sector. But even in that, I would like to separate hospital versus primary care versus a new emerging area, which is long-term care. In the hospital sector, again, drawing on the 14th Five-Year Plan, I think there's very clear signal that the public hospitals will be the dominant sector. And right now, there's a lot of reform initiatives to try to improve its efficiency and its quality of care through provider payment change, through building integrated delivery system, etc. But China recognized that the primary healthcare sector is rather weak. And so, and it's just not quite what the population need, right? China is facing an aging population, more people are going to have chronic conditions. So acute care will still be important, but it's not the most important thing. And what is more important is to build primary healthcare that would prevent people from getting ill. And in particular, early screening, early detection, managing their diseases so they do not need hospitalization. And that's where China is quite weak. And so China is right now rolling out integrated delivery system. And for those of you who are familiar with China, it's called Yilianti. Now, China's integrated delivery system is a little bit different from what internationally we understand integrated delivery system. In most places, especially England, integrated delivery system should be focused on primary health care. And then you coordinate upward. But China's integrated delivery system right now is led by big hospitals, and they try to integrate downward. And it's difficult because the primary healthcare part is sort of weak and people don't trust them. And I think the government recognized that there's a role for the private sector. For the hospital sector, the government has already identified that there's under capacity in certain specialty, in particular pediatric, psychiatric and mental health, geriatric, and a few other specialty. And those are the areas they really would encourage private sector to come in. And primary care is another area that's innovative, properly managed, primary health care that would suit what people's needs are and what people demand, meaning that good service and also trusted service has a big room for the private sector to come in. And then let me just quickly touch on long-term care. There's no question that, again, going forward to your next questions, a round of questions on the 14th five-year plan. If you look at the 14th five-year plan, aging-related issues is just very prevalent. It's just almost everywhere. And the elder care sector, the government knows very well that traditionally the government has been focusing on the very poor population. Now, there's also private sector who comes in, but so far it has been catering for the very rich population. So here's a fundamental challenge and question is, what do you do with the middle 80% who's not the very rich, but who's also not the very poor? What kind of private initiative can come in to cater to that part of the population? It's very difficult for the government to step in and provide for that itself. So there's huge room for growth. Now, what I have just talked about is the health-related policy. At the same time, we should also think about economic policy. Everybody knows that in stimulating internal consumption is one main strategy for China's economic growth. And actually both the health and the elder care sector has been identified as sectors for stimulating economic growth. So again, there's room. I guess the fundamental question is, what should be the new rules of game to put in so that you encourage healthy, vibrant private sector participation and such that it doesn't draw the resources from the public sector, because eventually the less wealthy will still have to rely on the public sector. So we want to be sure that there needs to be good policy and rules of game to be developed so that you encourage private sector, take advantage of its innovation, efficiency, but maintaining equity would be important to look at. So I'm just going to stop my comments now, and we can discuss further at the next round.
Thank you, Professor Gibb. We'll come back to some of the points you made earlier, especially regarding the 14th five-year plan. But before we jump to, move on to the present, I still want to have one more question regarding reflection on the past. We have a practitioner and investor in the room, Mr.Antony Leung. You have overseen investments into the healthcare and life sciences. In 2016, you co-founded a company that's dedicated to the healthcare services in China. Could you just share with us what propelled you and your business partner to launch that venture at that time? And from an investor's perspective, how did the timing correspond to the health policy and the macroeconomic environment in China? If you don't mind just sharing some stories.
Thank you very much. It's really delightful to be here. And I was taking notes when Winnie was talking about all the policy proposals and considerations. I actually wish that she would keep talking so I can take more notes. To a certain extent, later on, you'll see that what we are doing in New Frontier is almost exactly in line with what she was talking about, meaning first of all, we all know that private healthcare providers in China is only a supplement to the public sector providers. We all recognize that for equity reason and also for, in a way, national security as well as for economic development. The public sector healthcare is and should be the dominant part. But on the other hand, because China is such a large country and also a lot of the demographic changes, meaning aging and now the very low birth rate, there is room for private healthcare providers. Also, as you see a bit later, and as Winnie talked about, the public sector rightly should focus on the high acuity as well as the emergency kind of healthcare issues, such as, well, right now we are seeing COVID. I mean, only the public sector hospitals can really handle most of the COVID cases. So what I'm going to do right now is to share with you what we are doing, and then hopefully seek advice from Jin as well as from Winnie as to what we can do better. I hope you can see the slides. Now, we would like, I mean, obviously this is kind of what we are doing as well as what we hope to do. We hope that we can provide services in basically all areas, but in particular 3 areas. And the 3 areas are really supplementing what the government is doing. First of all, as Winnie said, the public sector providers should provide the bulk of the services to the bulk of the people. But as President Xi Jinping has said, what the government is trying to do is encourage common prosperity. Now, common prosperity, 共同富裕, is not really 共富, meaning it's not basically everybody sharing the same level of prosperity. So as we all know in China, there are people that got rich earlier, 先让一部分人先富起来. And for these people, those people that have the means, they may not want to actually get the healthcare services from the public hospitals because of the long queuing time and privacy reasons, so on and so forth. So the first sector that we engage in is really in the high-end healthcare services, which, as you may know, United Family Health is one of the leading hospitals in the high-end healthcare services in China. And we should note that we actually do not receive EBAO. So the payer of the healthcare services from Hemujiang are either self-pay or private healthcare insurance. And the second area that we engage ourselves in, which actually is bigger in terms of size, is in the area of rehab and home care. And these are the sectors that we need to talk about that China wants to promote. Now, as we all know in China, somehow because of trust and also maybe because of habit, whenever you've got a healthcare problem, a health problem, you go to a public hospital. Chances are you would prefer a 三甲医院, a 3A hospital. And so, unlike in the US, where the hospitals provide kind of less than half of the total healthcare services, in China, 90% of the healthcare services, or 95%, are provided in hospitals. So unlike in the US, kind of over 50% of the services are provided in the areas outside of hospitals, particularly in clinics and in home care. In China, it only is probably 5%. So, and as we all know, in healthcare, there are at least 5 areas of services. Obviously, the category may be different from what McKinsey or Winnie is defining, but I see it as healthcare at least would engage, will involve five parts. The first one is actually prevention. And then the second one is wellness, meaning the 保健. Hopefully you keep well and to go to hospitals or go to a clinic. Then the third area is diagnostics. The fourth area is therapy, treatment. And the last area is actually rehabilitation. And actually there's a sixth area which is very small, which isn't quite well provided in China, or at least it's not common, is hospice. Now, it may not be considered a healthcare services, but I think there's something that is actually quite needed. And so rehab actually is the last one, and the prevention and wellness should also be encouraged, as Winnie has pointed out. And so we have 2 businesses. One is the rehab, which includes geriatric rehab, and the other is home healthcare. And I'll quickly jump to how we organize. New Frontier Health is consisting mainly United Family Hospital and is present in the top tier cities in China. So we have a number of hospitals in Beijing, 2 hospitals in Shanghai, 1 in Guangzhou, and then 1 in Shenzhen, which is completed, and we're waiting for Yanzhou kind of acceptance by the government, but because of the COVID, is a bit delayed. It also would include clinics surrounding these hospitals, and right now we also have clinics in Hong Kong under the brand name Hill, 100% owned by us. And right now we have Hill Oncology Clinic, we have Hill Medical, we are going to open Hill Aesthetics and Hill IVF in Hong Kong. It's all in Central. And then the rehab is under the brand name Care Alliance, and the home service, which we send nursing assistants and nurses to homes, is under YD Care. And these 2 sectors, or these 2 services, we receive Yibao. Actually, it's mainly funded by Yibao, and YD Care, the home service is actually under the 长期护理险, is long-term healthcare insurance. So you see that the target markets are very different. But again, we are supplementing what the government is doing, and in a way very much in line with what the government wants the private sector to do. I'll quickly go over the other items which people may be curious about and have questions on. Now, technology is very important. I mean, it includes a number of things: internet, hospital, wearable devices, and obviously information system. I mean, in United Family Health, say for example, if you go to our clinic, say in Shanghai, later on, if you have needs in, say, Shanghai or Guangzhou or Shenzhen, then you don't have to, in a way, to input all your information again, because our coverage or information system is accessible nationwide within our group. And it is actually very important and can improve the quality of service, as well as making sure that the medical history of the patient is accurate and well covered. And then quite quickly to the insurance solutions, we have opened an insurance broker last year. And the idea really is, and we can go into it a bit later, and the idea is to promote private health insurance, not just to the most wealthy, but also to the middle class, because more and more people may seek private healthcare, and insurance, private healthcare insurance would supplement what the government is providing under Yibao. And then the others are just the investment activities, the house, the real estate that we have in healthcare. So these are roughly the pieces. So in total, what we are trying to build, and we are not just an investor, we are actually an operator as well as manager. And we do it all under not a fund structure, because as you know, under a fund structure, you've got to exit after a number of years. We are doing it under a permanent capital structure, so we can actually own it and operate for a very long time. I certainly intend to engage in healthcare services in China for the next few decades. And we want to be an integrated healthcare system that provides a lot of things, from home to clinics in the community, general hospitals, specialist hospitals, rehab hospitals, OH, geriatric rehabs, and also hospice, which is something very much a pet project in my mind, because I think in China we need a lot of hospice services as people age. In terms of size, in total, we have roughly 30 hospitals, close to 200 clinics and healthcare stations, close to 9,000 beds, 9,000 plus beds, 4,000 physicians and consultants, over 3,000 nurses and caretakers, so on and so forth. And we are actually present in close to 50 cities, and that obviously mainly are in the home care services. And we cover quite a lot of specialties. Right now, we're counting about 30, not just pediatrics and OBGYN, all the way to oncology, basically almost all the specialties that one can think of. And we are present in the more developed areas of China, the main 5 areas, Hubei, East Yangtze River region, Pearl River Delta, Western China, which is basically Chongqing and Chengdu, and the surrounding area like Lianyang. And then Central China, mainly in Changsha, we have just taken over Xiangya Kangfu Yuan, which is a 3A hospital in rehab. And obviously, we engage in a lot of the kind of charitable activities. Of note is that the United Foundation focus in particularly one area, which is providing HPV treatment, screening, as well as vaccination to the poorer countries or the poorer regions in the country. And obviously, we also support the fight for COVID. So we send teams to Wuhan, and right now, actually, we are sending people into Hong Kong as well. I'm not going to spend a lot of time on this, but basically, in this presentation of what we are doing exactly what Winnie is recommending the government to do, and that is to supplement what China would like the private sector to do, and that is on the higher end kind of consumer, as well as rehab and home health services to the middle class and basically hopefully everybody. And I'll stop here. Thank you.
Thank you, Mr. Leung. Thank you for providing a comprehensive overview of what the private providers are doing. Very helpful to know. And now I'm going to bring in a perspective of an advisor. Ms. Jingwan has been following the healthcare industry in China for many years, and has advises global and Chinese healthcare providers, insurance companies, and pharma companies, a broad range of topics. So based on your observation, Ms. Wang, what are some general trends and challenges in particular for these companies over the recent years? And how did healthcare professionals and their advisors like you reacted to this kind of trend?
Thank you. It's really great pleasure in joining the panel and also listening to the perspective and insights from Winnie and Antony earlier. If I were going to reflect on the evolution of the Chinese healthcare market over the past 10 years, I would just really highlight 2 broad observations. One is at the system level, second at the individual player level. At the aggregate level, if you look at overall size and growth of the private healthcare services market, it's actually very, very exciting and strong. So I think we always talk about the role of the private providers versus the public providers. I think both Wendy and Anthony emphasized in China, this is meant to be supplementary. But within the supplementary role, the share of the private sector has grown substantially over the past 10 years. In 2010, if you look at the overall share of private players within the broader China healthcare services market, it's less than 4%. It's 3.5% in that year. And then the latest number in 2019, that number is reaching about 8%. So the share has doubled, but that's not the full picture. That's not the only story. The share doubled in a period when there was such a strong growth of the underlying healthcare demand in China. The share doubled in a period when there was such a big improvement in terms of the BMI, health insurance, the funding, the consumer awareness, and also the accessibility. So in this period of time, this total pie has increased by about 3 times, from about 1.4 trillion to roughly 4.5 trillion. So if you consider the both doubling of the share of the private players and the overall 3 times increase of the broader pie, so the absolute growth of the scale of the private providers in China was very exciting. It really has increased by almost 6 times over the past 10 years. So at aggregate level, at the system level, I think we are quite excited by the growth and also the future space for the private sector as a whole. At individual player level, the story is a little bit different. I think here we see, more complexity, more challenges. It was very inspiring to see the profile that Anthony shared on New Frontier and also the premium group like United Family Healthcare. But there are very few other players that have similar skill. Across this big segment that I talked about earlier, it was really spread across thousands of individual players. There are very few private hospital or healthcare group that have the skill and delivers high quality, not only in terms of clinical excellence, but also patient-centric services. Very few has real world-class operational efficiency. That is maybe the challenging or even frustrating part for some of the players and a lot of the investors. So there are many underlying drivers. I will maybe just mention 2. One is really the local variation. Second is the capability and talent in this segment. I think in terms of the local variation, I think when you would have a national player, national group, you need to have a playbook. That playbook works in most places for the same segments. It's already very hard for the provider business compared to, for example, life sciences, because this is truly, in many ways, right, labor-intensive industry, right? It's really involved humans and services. It's hard to standardize, but still in China, the barriers to standardization is much higher compared to other Asian markets. So you would have very different local environment, not only in terms of policy, the BMI access, the funding, but also the role and capabilities and profiles or competition with the public providers. So every city is different. It's just so hard for a private player to really elevate its own success in one place, in one hospitals, to a broader set of cities and segments. So that playbook is very difficult to deliver. That's one. Second is really the talent and the capabilities. I think we talk a lot often about the clinical talent shortage. That's still very, very true. But even in terms of the management capabilities, it is still a very big gap. If you compare to life science or biotech, that was also very, very new industry segment for China. 10 years ago, there were very few successful professionally run biotech company in China, but there was so much to learn, to borrow from other places, right? But for this segment, it's very difficult. The managerial talent requirement is so different from, I would say, out of China. So it's really hard to transfer those capabilities, those skills, and process and the playbook into this place. So we have to develop from the very beginning. So I think from the, I talk a lot about challenges, but at the end of the day, it's really a timing factor. This really means that they will take longer for these industry segments to see a lot more successful, high-performing organizations.
Thank you so much for sharing. This is very important for us to know and to keep in mind. Earlier, Professor Yip has mentioned about the 14th five-year plan, and Mr. Leung and also Ms. Wang has also pinpointed on some of the points in the plan. Before we jump on to the next point, I just wanted to spend a few more minutes on this topic. Now we have more policy support in areas such as aging population, three-child policy that focuses on the health of the population in general. How do you see the policy support impact the growth of the private players in the next few years? If we can maybe start with Professor Yip and then Mr. Leung and Ms. Wang. Just some quick thoughts.
First of all, I want to comment that the 14th five-year plan, the priority, the goal for the 14th five-year plan is to develop health policies that would assure affordable and equitable access to good quality healthcare for the people. So that's the driving point. And it is from that goal and direction that the government then decide on what is the role of the government versus the role of the market. And so I think in the area of health insurance, there's no question that the public insurance scheme is feeling the pinch of rapid growth of health expenditure, and therefore the premium that they have been collecting or putting into the insurance scheme is really pushing against the boundary, the envelope. And that's what pushed them to try to define what is basic, what is the government's role, and then the rest of them can be introduced as private insurance. So what is the policy that has been developed to encourage private insurance? I think at this moment is still limited. But if you look at a number of cities like Shanghai, to say the obvious, you see that there's a private insurance called Huiminbao, right, which is supposed to be affordable, but also private, that is actually co-branded between private and also the government to get people's confidence to buy them. And so you can say that that's one sort of government policy of encouragement. And in terms of delivery system, insurance now actually do pay for both public and private hospitals if they actually satisfy certain quality standard. And the question is whether private hospitals actually want to be part of it. And that varies quite a bit. In medium-sized cities, yes, hospitals do want to be part of the insurance payment, the public insurance payment, because public insurance, I mean, if you cover 96% of the population, then pretty much if you don't get to be part of the contractor of public insurance, you're losing a big market of it. But whereas if you're in richer places and if you're selling very specialty care, that's a very different dynamic. So you asked me, what specifically is in the 14th five-year plan that would support private sector? The way I read it is this 14th five-year plan is actually more implicit in terms of the explicit policy to support private sector compared to the previous five-year plan and the previous five-year plan. So we're still observing where is the pendulum swinging. However, the way I have read Chinese policy is as long as it doesn't say that it will not encourage the growth of the private sector, the room is there. But I think this is the right opportunity for private sector to sort of demonstrate to the government what works, right? I mean, what I have observed is that the government is sort of leaving it quiet, let the private sector try different things, then they would observe what actually are good what actually are good practices, what actually are not good practices, and then it would develop policy. I've understood from many private investors, they always complain and said that's actually a very difficult environment to work in because rather than knowing the rule of game ahead of time, usually it starts with a very broad open space, and then the government would observe what they want to keep, what they want to eliminate, and then introduce policy. The way I have read the 14th Five-Year Plan for the private sector is a bit implicit now, except laying out the goal and the principles that, yes, there are rooms where private sector can play a role. So I would be very interested to hear how Anthony and Jin think about this.
Well, I think, Winnie, you are the expert, and Jin obviously has a lot of insight. But from our point of view, what you said is exactly true. I actually quite like the way that the 5-year plans are heading, and that it's not quite prescriptive, but more actually looking at the direction and then leaving the market to so-called supplement what the government is doing. As we said, the government focuses mainly on the diagnostic and treatment, particularly on the kind of high acuity as well as the emergency kind of critical issues such as COVID. So that leaves the prevention, wellness, and rehab mainly to the private sector. Also, the government is facing at least the 3 broad trends that Winnie touched upon. The first one, obviously, is aging population. China's population is aging much faster than earlier 5-year plan had been planning. Secondly, luckily, the personal income is also rising. So when people have more wealth and they're aging, they want a healthier life. And it falls into the demands of the healthcare. And the third one is what Winnie also talked about, the public health insurance. Right now, they're feeling very stressed. Some people may actually have commented that they may not be able to pay out or cover the expense that is being incurred now. So going forward with an aging population, the financial strain on the public healthcare insurance is obviously even more difficult. And this would give rise to the demand for private healthcare. But as Jean also said, in China, because of the peculiar regulatory structure and the way of governance, it's really difficult to build, not to say a nationwide, but I mean a scale operation, because not to say every city may be different. I mean, in our provision of home health care, every district in a city can be very different. And so it makes the operator very difficult to really scale up. But on the other hand, scaling is important because one, there is the need for people to travel, particularly the high-end people. So if you travel, if you have to visit different hospital systems, then you have a difficulty of whether you can find people that you can trust with the quality of care that that you can really place your life in. Secondly is really, so the first one is we need standardized quality benchmarks of care. Secondly, with scale, then we can have economy of scale. The scale mainly happens in the usage of technology. Because if you have only one hospital or one clinic, and you want to adopt leading cutting-edge technology, is very expensive. So whereas on the other hand, say if we have 30 hospitals, we integrate or we adopt a common system on HIS, then we can have 30 hospitals to share the capital outlay. And then the equipment, like we are one of the early adopters of using Mako, Da Vinci robots. I mean, you need scale to support them. And we are also looking at other things, such as, on the other hand, wearables. Wearables are cheap. On the other hand, just one wearable is not good enough. You need a kind of back-end system to really make use of the data. So the need for scale is inherent in the industry. But the regulatory environment in China actually makes it very difficult. But on the other hand, if it is not difficult, then there may not be room for people like Leung to successfully compete in a sector that everybody knows will grow.
Thank you so much.
Jin, over to you.
Yeah, Ms. Wan, do you have anything to add?
Yeah, I'll try to build on maybe the framing of Wen a little bit. I really like what you said about the implicit versus explicit. I think sometimes as we observe the market and help with some of our private clients, they felt the importance of having clarity at the first level, but also at the next level. I'll just take one example. I think both of you touch upon in terms of the private house insurance. We have seen a lot of support in the 5-year plans over the past few cycles. But if you look at the overall size of private house insurance, it is still incredibly small. So there are, again, many drivers of this sub-scale sector. As we talk to the consumers, as we try to understand why majority of the consumers who could have benefit from health insurance are not buying, I think part of the confusion was they didn't feel explicit need because they had the impression that the healthcare needs, basic or not basic, is going to be covered by the government insurance. It's really hard for average consumer or even a highly educated consumer in Shanghai and Beijing to tell before they have disease what's going to be the specific boundary of the government basic medical insurance versus what could be covered, protected by a different private scheme. So this is not supposed to be written in the government 5-year plan. But again, I think this level of explicit clarity could really benefit the private sector. So that you could have a much more clarity as you develop their business models, their products, educate the consumers. This will help unlock the consumer demand as well.
I think, if I may, Wei-Shi, to kind of follow on what Jin has said.
Please.
The government recognized that the private health insurance is very much needed to supplement what the public schemes has today. But on the other hand, the challenge is not so much on the demand side, but also on the supply side as well. Because up until about 2 or 3 years ago, when I was talking to somebody that was in the government, but then joined the private sector, he told me that based on his knowledge, and Jin probably can correct me if I'm wrong, almost all the private health insurers actually lost money. And while everybody is also complaining that the premium for private healthcare insurance is high, but they still lose money. And one of the reasons is this, because the insurers cannot control the payout, because the payout or the cost, they are being incurred in healthcare providers, clinics and hospitals, particularly hospitals. And in China, not all, but I mean, it's very difficult to control the overuse of drugs or over prescription of examinations. And so you have this particular problem. And sometimes, obviously, because of competition, the structure or the design of the insurance and in arriving at the premium may not exactly may not be based on the actual payout position, because a lot of the health insurers are also providers of life insurance, and they treat health insurance really as just an adjunct business, and they make most money from the life insurance. So we have one difficulty in controlling the payout, and secondly, a lot of the insurers would just treat it as kind of an also run or a entry product, leading the or attracting people to buy life insurance after they have bought the health insurance. So because of this situation, private health insurance is not really growing. And that, in a way, is the reason why New Frontier, we started a life insurance brokerage business, because we are a healthcare provider. We believe that we can control the expense better. And United Health Family, we pride ourselves for not over-prescribing on medicines and not prescribing checkups. So in a way, we can control the payout much better than those insurers or the insurance brokers that are not really healthcare providers.
I think what Mr. Leung just talked about is not just the situation in China. You observe that in Hong Kong too. We observe that, which is just a widespread issue in every country that I have come across. And so it's a fundamental question is, can private insurance have enough market share to negotiate a way of payment with the provider that would sort of constrain their behavior in overuse? And that always has been difficult if you're a small player. And in the case of China, especially when you have Yibao, the big player that is the dominant purchaser, so the room for private is more complicated. However, I do think that in the next few years, China is going to move towards defining much more clearly what social insurance will be covering. Whatever that is not covered, that provides the room for the private insurance. And then for those services, some private insurance might eventually have enough market power to leverage their contract with the provider. Yeah.
I'm sure we can talk about insurance and potential vertical integration for many, many hours, but it's hard to believe that I only have 10 minutes left. I can't let you go without asking a question about responsibilities. And actually, we also received some questions from the audience regarding the role a private care provider can play. As we're all aware, China, especially in cities like Hong Kong and Shanghai, we're still going through battling the pandemic. Do you think that our private care providers are doing enough to help public hospitals combat the pandemic? And if not, what kind of policy support do you expect or would be helpful for more private providers to jump into this combat? And if we can extend the discussion a little bit further, in case of any future, hopefully no pandemic, but future public health crisis, how can public and private providers collaborate better to serve our communities? If we can start from any view, that'd be great.
How about someone else first?
Why don't I start first, because we are the provider. But the answer is the private healthcare providers should play a role. But on the other hand, having said that, it should be well coordinated by the government. I see that there are criticisms on the Hong Kong private hospitals. And by the way, we don't have private hospitals in Hong Kong, we only have clinics, not shouldering enough responsibility. But on the other hand, for private hospitals, there are some big ones and some small ones. Not all of them are capable in taking in COVID patients because they are highly infectious. And some private hospitals may not even have kind of 5-year的门诊, meaning the clinics or outlets for taking in the fevers. So because private hospitals, we have a range of private hospitals. There are some very good ones, there are some smaller ones, they may not be capable. So I can see that what the government should do is look, in Hong Kong, as you know, almost 90% of the hospital beds are provided under the government hospital authority. Only about 10% or 12% are in the private hospitals. And not all private hospitals, as I said, are capable in handling COVID patients. What the government should do is that, look, out of, say, the 32,000 beds that I have in XA, we would devote, well, as recently, just now they said, well, we will devote 9,000 beds to COVID cases if needed. But remember, in Hong Kong, all these 30+ beds are fully occupied now, because otherwise, if not, then some of these kind of chronic illness cases in Hong Kong, as you may know, would have to wait about 2.5, 3 years. So all these beds are already occupied. So if they have to vacate 9,000 beds, then somehow they have to move to the private hospitals. But may I remind you that in Hong Kong, the private hospitals in total have less than 5,000 beds. So they are not enough to take care of these so-called overflow. But right now, because the government hasn't really coordinated with the private hospitals, so the private hospitals, on the one hand, they say we are not capable in handling COVID. On the other hand, the government is not allocating some of these cases into the private hospitals. So I believe that primarily, it should be the responsibility of the government in coordinating how to provide all these necessary beds in case of pandemic. And by the way, I agree with you that we hope that there will not be another pandemic, but I can assure you pandemics will happen. So I think that one, there is a role. And secondly, there is also not just a matter of beds. Like I mentioned that in supporting Wuhan, in supporting right now Hong Kong, Renew Frontier, we actually send employees and send materials into Wuhan, into Hong Kong. So these we can do. Right now, it's not just hospitals. We are sending nursing assistants from the mainland into Hong Kong to staff some of the isolation centers. So these we can do. But hopefully these can be well coordinated as well. Right now, we are kind of doing it kind of sometimes ad hoc, but in the case of Hong Kong, we are working with the government. But without a central coordinated effort, it can be messy. So I would say the answer is yes and no, but the primary responsibility has to be a well-coordinated effort by the government.
Jean?
I'll just make a quick comment. I think at the time of this, I think the private providers need to be a part of the broader system and contribute its own resources and expertise. I think in a sort of a normal time in the system, I think it's to be extremely simplified, right? Private providers will create more competition and total capacity to serve the consumer's demand. The competition will be among the private players. They will be with the private players, but at the end of the day, it's really about delivering better clinical and patient and high quality patient services. So this fairly simple role for the private providers, but it's not going to go.
I want to echo that during a pandemic time, it is an unusual time. The government has to step in to play the conductor's role. And I'm sure you have seen around the world that places where we have seen chaos is when that conductor's role is actually not played properly. But I also think that I hope that in the future, the focus of the discussion is not so much at the hospital level. The focus for pandemic control really is the community level. The better you do at the community level, the less stress it is going to be. Community for what? For vaccination, for detection, for all of that. I mean, so really the strategy is to reduce hospital use, the need for hospital use as the most important strategy. Then you can talk about whether it is public or private, what private role should play. And I think that during pandemic time, all countries should recognize that it is an unusual time. Whether you're public and private could be and should be called into playing some special role for that particular period.
Thank you all for your comments. I think we might have time for just one more question. So this is a nice segue to our discussion about the future. Some of you have already mentioned about digitizing medical services and the future of digital hospitals in China. We have one question from the pre-submitted audience who mentioned about the data privacy. As you're all aware, data privacy from the patient is a sensitive topic around the world. both from the provider's perspective and from the patient perspective. In this regard, could you share your view on the prospect of digital hospital in China? How do we handle the data privacy in terms and versus the need for more services?
I'll just quickly say 2 words. I think that let's go beyond digital hospital, because digital hospital is something that is very China specific. Let's talk about digital health in a very broad sense, including internet-based consultation, remote care. I think that is the future. We cannot avoid that. And that's going to play an increasingly important role. And I think there is great promise of using digital health to reach the poorest, the most remote area, to reduce waiting time, to improve access to care. What right now is a little bit unclear is the quality of care that is provided over this platform. And confidentiality, I'm sure there are ways to be worked out. I mean, confidentiality is not new. There are many other areas, including data share for many other purposes that you can use. There are clear ways to protect people's confidentiality. So I don't think it's a technical problem. It is more how you roll it into a policy.
Thank you. Mr. Leung or Ms. Wan, if you can share some thoughts.
I'll make a few comments. Yes, just very briefly. I think maybe start with a number. If you look at the average per capita outpatient visit a year in China, on average, it's really just around 6 times a year. That is much lower compared to many other more mature markets. So among that 6 visits a year, digital captures about 5% as of last year. It's a small share. So the growth of the digital health could come from increased share of that 6 visits a year or beyond. Because I truly believe that 6 times a year could double if we really use digital to provide more, screening, more prevention, focus on chronic disease management, and also support during the rehab period. So I think that digital health has a significant role beyond that 6 patient visits a year in the current situation. So there's a lot of hope and opportunity.
I think I support all that Winnie and Jean has said. Digital health or technology is here to stay and will play an even more important role. 2 points though. One is that healthcare in the end, it has to be at some point of time an offline service. Just online may not work. So whoever that can really integrate the online versus and also offline services would actually do extremely well. As I said earlier, we're exploring the use of, say, using wearables and other devices at home so that we actually can monitor the patient's condition and in a way forewarn that something major may be happening and reduce the need of, say, going into emergency rooms. And the second thing is when we have, first one is online, offline integration. Secondly, the more data we have, particularly on a nationwide basis, the better it is for us as an individual provider, as well as for the government to in a way predict what may happen. I mean, I'm sure you have read books that even 10 years ago, Google actually can predict an endemic happening in a region faster than the US government, because when you look at what people searches on Google, then they can predict something may be happening. Likewise, the more data we have, the more predictive and actually effective in providing healthcare services, either on a prevention or on a treatment or actually on a rehab basis. So I think these are the issues that I'm sure the government is working on. I know that the Ministry of Health in China are collecting now a lot of data from all the hospitals in China. And I'm sure they're using it well, but there is still a lot of room for improvement.
Well, thank you so much for all your comments and thoughts. I very much want to keep you and keep you talking here, but just cognizant of the time, I think I'll have to conclude our chat today. Healthcare is a very big topic and a very important area for all of us to focus on and to pay attention. Thank you for bringing your thoughts and expertise from different angles. Really appreciate your time and thoughts today. I hope that we can keep in touch. I hope our audience enjoy the talk today. Thank you so much. Have a good day and have a good night.
Thank you.
Thank you.
Thank you. Stay healthy.
Thank you.
Stay
Take
safe.
care. Take care.
Bye-bye.
Bye-bye.